Hello everyone, welcome to another episode of TooHealthTalk. A health show where we talk about real health challenges that matter to you and we get to break it down in a very simple and honest conversation. On today's episode, we're having a very special guest, a family physician from the UK. So please, if you want to see more of these doctors come on board, talk on our show, please we're pleading for you to like, share and subscribe and share your thoughts in the comment section. You can ask your questions and the question will get to the doctor. So please, for you to support what we do here, just subscribe, like, share and comment. So right now we'll move to our guest, our special guest. We have Dr. Chukwugozie Ujam, a family physician in the UK. Welcome to the show, doctor.
Thank you very much. Thank you, viewers.
So doctor, on today's topic, we'll be talking about diabetes. Diabetes is one of these diseases that gets to affect everyone, from the nowadays, it's even from the old to the young. Diabetes is everywhere now. So I just wanted to give us a little insight on what diabetes is.
Okay. So thank you very much for the question, and thank you for inviting me onto your show.
Thank you. Welcome.
I think that first of all, let's go through some myth busters. Diabetes itself. I mean, you've got several types of a couple of types of diabetes, but diabetes mellitus, which is the one that I think that you're talking about, has to do with the body's ability to handle sugar, or the inability of the body to handle sugar, and it stems from one of two things, or sometimes it's a combination. But it's about the chemical that is produced by a gland in the body not producing that chemical enough to break down or deal with, sugar and its breakdown, and the other is just where the body itself is just overwhelmed with the amount of sugar that it's got in its system. And that's why we've got two different types of sugar. There's a classification where you've got stuff that is insulin dependent, and there's non-insulin dependent. Further classifications have them as type 1 and type 2. And in order to just put a bit more to what you said before, diabetes has always been rife in the society. People are born with diabetes. People develop diabetes as they grow older, possibly because of a few of the lifestyle measures that they've gone through, or their lifestyle. So, in a nutshell, it's just about the disorder or the inability of the body to handle sugar.
So you're saying diabetes is a sugar disease?
You can broadly say that it is more of a sugar disease, yes. It has other causes, but just to pitch this at the level of the general population, I think that we should just say it's more of a sugar disease. And when we say it's a sugar diseise, I'm not saying that if you take too much sugar that you're going to get diabetes. It's about the way the body handles the sugar.
Because I'm already scared of what if I take 2 bottles of Coke every day? I take sugar in my pap. Take sugar in. I get diabetes.
Surprisingly, I'll be very surprised if you were going to be taking 2 bottles of sugar of Coke every day. So whilst we encourage people to live and their diet and regime should be in moderation, I wouldn't be advising people to be taking a bottle of Coke every day. That is not to say that we don't have individuals who take quite enormous amounts of sugar who are not diabetic, okay? But you can have a predisposition if you're taking too much sugar, because you're going to start overwhelming the body's ability to deal with the sugar and break it down anyway. And that is that is why some people develop diabetes later on in life. It has to do with lifestyle. There are other risk factors which we can go into at some point.
You talked about type 1 and type 2 diabetes. So which one is more common here in Nigeria?
Okay, so remember I said that there's some people born with diabetes. Those are and really more commonly people who are dependent on insulin, because insulin is that chemical that the body could not produce. So you have to what we call exogenous. So you have to give it to them. But in this country, we've found, and this country being not the United Kingdom but Nigeria now, so the more common is those who are not necessarily dependent but who have developed it in adulthood, so it's adult onset, and that is type 2. So type 2 is a bit more common in this country.
Wow.
Yes.
So is it like a death sentence? Diabetes, is it like a death sentence?
No, it isn't. The short answer is no. So that's why I talked about the the factors. Okay, so the dietary intake, one's weight, coexisting things like high blood pressure. Some people actually crack a joke that high blood pressure and diabetes are like cousins because of the effects on the human body. So talked about what we ingest. There are also familial things, familial reasons why people can develop diabetes. There are also diabetes that can be caused because of the medication one has been taking. For instance, or for example, prolonged use of steroids can lead to diabetes.
So I have to talk about when you get like fast, you get diabetes.
When you get what?
To fast, like fast more often, you get diabetes. Is that true?
I would have thought that is correct. Not in itself. So, certainly for some people, fasting is actually very good. Okay, I tell my patients that this cup cannot get full unless you pour something in it. All right. But in terms of fasting, if you do fasting the healthy way, you shouldn't get diabetes. Diabetes is not because you've been fasting. More often than not, it's because you've been overfeeding, to be honest.
Oh.
Yes.
So you also talked about diabetes being from hereditary.
Yes.
Is it like 100% hereditary, or it just gets happen?
It's not 100% hereditary. If it was, then we'd already have a certain lineage of people who already have diabetes, who would normally have diabetes. And we found people who have parents who are diabetic who are not diabetic, partly because they've addressed those risk factors. For instance, they don't smoke, they don't drink, their weight is in the normal BMI, which is a basic metabolic index. So, for those people they try to combat those risk factors. Yes, we do know that the genetic makeup is a risk factor, but not everybody whose parents suffer with diabetes will get diabetes, and it's not strictly true.
Is there like a worst food that can give you this diabetes?
So the problem that we find is that once people have had the diagnosis of diabetes made, then they need to look at what they've been taking, as if what they've been taking has been the culprit. No, it is that once you're diabetic, then you need to control what you are eating. So there's nothing like this. But if you eat a specific, for instance, if this is, using your example, Coke, or your pap that you say you put sugar in, that you're going to get diabetes. That is not true, because your body may well be able to handle it. But the point is that if you're diabetic, it then means that your body can't handle sugar properly or adequately anyway. So the advice is to cut down on the sugar. Do you understand what I mean? They're two different. There's a nuance. The nuance is slightly different. So there's no particular food item that you're going to ingest and then you're going to get diabetes tomorrow. No, I'm saying that if you have the propensity to put on weight because you're taking sugary meals and all these fast foods and muck like that, then you should cut it down, because you're helping yourself. You're going to lose weight. You're going to be, that's why we talk about people exercising themselves and everything, because they already have the risk factors. They have the propensity to develop diabetes. That is not to say that if you take it, you're going to get it. No, we're saying if you take too much and you have the risk factor, the propensity, then you'll get it. And we're also saying that if you've had that diagnosis made, and cutting down on certain food items will, we've had people who are no longer diabetic who we've made diagnoses of because they've lost weight, they've cut down on the horrible foods they're eating, they're exercising more, they're looking fit, they're no longer diabetic in terms of the adult onset diabetes, which is the type 2 that many people suffer in this country.
So can this diabetes cause sexual damage to both man and woman?
I'm going to be reading in between the lines when you're asking me that question. So the point to make is that diabetes affects all the organs in the body, or rather can affect all the organs in the body. It can affect various systems. One of them is the nervous system. And for men, if diabetes affects the nerve supply to the groin area, then yes, you'll have, infertility issues or the inability to sustain or at least achieve an erection. So we do know that diabetes is a risk factor for, infertility or, sort of erectile dysfunction. We know that because the nerve the nerves have been damaged because of diabetes, yes.
So are there any early symptoms because of diabetes?
Okay, so let me limit my answer to the more common diabetes, which is a type 2. So you will find what we call polyphagia, polydipsia, polyuria. So that means that there will be an increase in thirst, there will be an increase in hunger, and you'll be passing a lot of water, you'll be making a lot of wee. Okay? So the thirst, the urine, the food, okay? Those are the three things that typically will bring the patient to us and saying, I used to pee once or twice a day, and maybe once at night. I'm now peeing a lot more during the day, I'm peeing a lot more at night. I find that I'm always thirsty. I'm reaching out for bottles and bottles of water, despite it not being necessarily sunny out there. I'm finding I'm always hungry. I just need to eat. So those are the things that would heighten the suspicion or index of suspicion for the doctor to say, do you know what, this person may be diabetic, and therefore you run a certain test.
So is there a routine check for you to if you don't have all these symptoms, is there how can you check? Is there a time frame that the age that you must be so big to do a blood sugar test every 2 weeks or every month? Is it age you're going to reach?
So to answer that question, remember that I've tried to do a broad classification that the type 2 is more generally adult onset. That's not to say that you can't have 15-year-olds who are taking the metformin tablets and therefore they're not insulin dependent. But more generally, when you get to adulthood, we would recommend a test. But you don't go willy-nilly testing if you don't have symptoms, because unless you've got risk factors, maybe hereditary, there's a family history of ischemic heart disease, those high cholesterol, those sorts of things, then you want to be doing a routine test early so that you can nip these things in the bud. Or if you find that you notice that your habit is, you're quite overweight and that sort of thing, and that's not me body shaming, but there is some association with being overweight and diabetes, then we want to test you early enough. But that's not, if you're in secondary school, you go testing, because the younger age group, if they're diabetic, they would have been discovered pretty early on, and those are the ones that are more often than not insulin dependent. But the non-insulin dependent ones are the ones who are, above 40, and you want to be checking yearly, a routine check. But that's the doctor who's requesting those tests must have a reason for requesting those tests. You're not just going to be requesting tests, and one has to take into consideration the cost of these tests, the effect on the economy. You're not just going to be sending people for tests that are probably going to come out negative anyway. Yeah. There has to be an informed decision as to why you have to do that particular test. And all that is in our consultation, and that's one of the things that personally I want to encourage in this country is about people seeing their family doctors so that we can get these things sorted out early. Yeah, one of the major things that family physicians in the United Kingdom is to target things like diabetes, target things like high blood pressure, so we can nip these things in the bud and ensure that there's a longevity of life for the citizen.
Yeah, sure. So if someone is diagnosed with diabetes today, can you give 3 advice the person should do?
Okay. So I'll take it along the lines of things that I've said. Lose weight, exercise more, moderate your food intake. Beyond that, continue to test, because we need to monitor what your sugar levels are. There are people, so the classification, for instance, I think that we have that in this country as well, is that you've got people who are frankly diabetic, there are people who are borderline diabetic, there are people who are not diabetic. Now, if you belong to the group of people who are borderline, so those are the ones that will strictly be saying, monitor what you're eating, do more exercise, get into some lifestyle changes, because you can move the needle from borderline to normal. And we found people who are frankly diabetic who have chosen not to go onto tablets but to try and do lifestyle measures along the lines of what I've said before, and they can move into the borderline. And if they're lucky enough and they've got more time in their hands, they move back into normal.
So the lifestyle one is going to have herbal drinks and herbal medication.
I have not used the word herbal. I have not used the word herbal. What I have said is lifestyle.
So does herbal medication works?
You know what? I think that the truth of the matter is that we understand that there's unorthodox medicine, and I can't comment on unorthodox medicine. That's not me saying yay or nay. What I'm saying is, for at least for the profession that I've been trained in, that we need to do. There's medication for it if you're non-insulin dependent. If you're insulin dependent, please, there's insulin that you should be using. And in the laboratory now, they're coming up with a whole lot of medication that is not just metformin or things that people can have, or long-term injections that people can have just to suit their particular lifestyle. There are people who don't like, they will never take a tablet for anything to save their life. They'd rather have an injection. We have that amongst people like some lorry drivers who just take an injection, last them a month, and they're good. Along the lines of the exercise, you can imagine that lorry drivers are just sedentary. They sat there for long hours. They're more prone to putting on weight. They're not really exercising. Those are the people that you want to really do the exercise, lose weight, but they get diabetes. You have to suit their lifestyle, because they're not going to stop the lorry driver, because that's their livelihood that you're going to cut short. So we're there to help each other, but some work has to be done by the patient as well.
Yeah. Thank you very, very much, Doctor. I've learned a lot from you today.
I hope you have.
Yeah. So in 30 seconds, you just have to just give a general advice to our viewers on what to do on diabetes.
I think that if we're to use one word, it's going to be moderation. Okay, watch what you eat. Think about your lifestyle. Stop cigarettes. Reduce your sugar intake. I'm not saying that sugar causes it, but you do well to reduce sugar intake. Do a lot of exercise. Reduce your alcohol. Quit smoking. I think that you're on the way to healthy living.
Thank you very much, Doctor.
You're welcome.
So today we've come to an end of the show. So I want to thank you for staying up to this moment, and please support what we're doing. Like, share, subscribe. And also, if you have any question for Doctor, just drop it in the comment section. It will surely get to him. Thank you once again for watching. See you in the next episode. Bye.
Bye-bye.